It's a great pleasure to be with you today, and I feel very privileged to be part of this international conference. Today, I am talking about artificial intelligence and embryo assessment. And really, when I started uh, to search and prepare this lecture, I found the topic is very deep, and really, I feel that I need to edit a book, not only a lecture, because it's a very promising subject. I hope you can see my screen.
Yeah, you can maximize it. Screen
Okay.
slideshow as a slideshow.
Yeah.
Just at the bottom right of
Yeah,
yours.
I'm trying.
You can put it on maximize mode.
Yeah.
And yeah.
Is it okay now?
Yeah.
Yeah. And it's really a big topic, and it's sharing with between embryology and IT. So I don't have anything to disclose if I mention any brand or commercial name in this presentation. Artificial intelligence has been implemented in all the medical specialties and resulted in significant impact in the practice of medicine. This includes the assisted reproduction technology. In assisted reproduction technology, artificial intelligence is used to predict the success of ART cycles. That is, at the start of the cycle, when a patient comes to see the physicians, and depending on the patient history and the status, it can predict the outcome of the cycle, and it can predict the oocyte cryosurvival and development competence. It can judge on every single oocyte, depends on the patient history and the oocyte morphology. And it helps in embryo assessment, which is the focus of our talk today. Embryo assessment includes the morphology, morphometry, morphokinetics, and the chromosomal contents, the PGTA. And it helps also in lab performance and the KPIs. It can help to make KPIs for the physicians and for the embryologists, as well as in quality control. Artificial intelligence is defined as is a machine that use multiple tools, including machine learning, to think rationally and act rationally like a human. So the target of artificial intelligence is to produce machines that can think like us as embryologists and can take decisions or make suggestions, but in a faster way. To develop artificial intelligence, the first step is to have scientific data. Scientific data will lead to deep learning. And the deep learning will enable us to feed the machine with the deep knowledge we have, and to give the machine learning, and finally we'll give artificial intelligence. I will give one slide about each of these. So the scientific data. At the start, when we used to transfer embryos at the blastocyst stage, at the very early stages, we used to transfer all types of blastocysts. So at that time, we didn't which blastocyst will give pregnancy and have much chances to give viable live birth. So this is the scientific data. After having a lot of data and pictures and analyzing them, we have deep learning. In this deep learning, we know that such blastocysts in the picture have lower chance of giving live birth or causing pregnancy. And these two blasts on the right-hand side have higher chance. We did this after making retrospective analysis of the blastocysts that were transferred to patients. So after that, we will go to the machine learning. Machine learning is considered as a sophisticated statistical model that used for prediction, and it keeps improving by time. That is to say, the more we work, the more we give information to machine, the more we have better results and better predictions. So machine learning has three main levels. So the level one is called the unsupervised learning. In this level, the system is given examples and know how to differentiate between the general knowledge. In the embryology, we teach the machine how to differentiate the oocyte and various type of oocytes and embryos and blastocysts. So this is general knowledge at level one of the machine learning. The second level is supervised learning. We give the system examples and we show the system the output of the examples. Here we have one good blastocyst. We give it to like several pictures to the machine, and we give the result to the machine that this quality of a blastocyst can give us a healthy live birth. And the other thing is this quality of a blastocyst will give us a negative HCG test. So we teach the machine, and after the machine system is taught properly and taking thousands of pictures and information from us, it will be able to give us a prediction. And the third level is the reinforced learning. This system takes action and learns from the good or bad outcome. As we give the machine early in the previous slide, we showed it the good slide, the good blast, and the bad blast. This will enable the machine to give a prediction and the scores of the possibility of having pregnancy. So in this slide, we can see the machine give us a probability for pregnancy for each individual embryo. Like the lowest has a chance of 20% and the highest has a chance of around 90%. This is according to the prediction of the machine. And the machine learning will give us the artificial intelligence embryo selection. The machine learning tool led to the development of software that can rank best embryos for each patient. And there are a number of commercially available software developed by time-lapse manufacturer and even by IT suppliers. I had the chance to talk with a time-lapse manufacturer, the three main ones in the market, and all of them have the software that can predict and help for embryo selection. The software are objective. This means they judge on every embryo on the same way, and if you give the same embryo after several times, it will give the same result. But nothing is 100% guaranteed. Like the system cannot guarantee it's 100% you will get to pregnancy or live birth. So after we check the embryo morphology, and the embryo is beautiful, it is not enough that, and it's not enough that the embryo will implant. We have a lot of beautiful embryos and good-looking embryos that are unemployed. So the artificial intelligence help in improving the results of the next generation sequencing result for PGTA. Usually, in most of the results of the PGTA, the results can be like clear, but at in some embryos, an interpretation varies among the geneticists. So the collection of data and the artificial intelligence help us to improve the interpretation errors in the next next generation sequencing, and it limits the subjective interpretation, especially when interpreting mosaicism. Sometimes when there is mosaicism, one scientist like say this is 40%, the other one say it's 60%, and there is some like different points of view, and the artificial intelligence help us to eliminate this individual interpretation, and it builds reference data that correlates the NGS results to the healthy live birth. So when there is a data and there is there is doubt, it links it to the data from previous implanted embryos and resulted in live birth. And we can consider it as robust and accurate interpretation. So the conclusion is the artificial intelligence is a promising tool in embryo selection and in assisted reproduction technology as a general, and it has been implemented in ART for a few years now, and it helps in decision making, and it keeps improving by time. Whenever, like when I see the manufacturers who make the artificial intelligence software, when I meet them after a few months, they told me we updated this and that in our system, and we can have better prediction and better selection for embryos, and surely it saves time. Like in my lab, we have a rota for annotation of embryos in the time-lapse incubators. So when this system comes, like it do auto annotation and saves a lot of time, and it can do like several embryos together at the same time, and it can do it much faster than the human. And it's really an area of intensive research, and it's still, but it's still in early stages, needs a lot of development. There has been some development in the recent few years, but we still need a lot of development to make better achievements in this field.